I'm Meredith, and I am here in studio with Dr. Cannon. SleepBetterSarasota.com. Check them out. They have changed my husband and my sleeping life. So, Dr. C, I have a question for you. What are some diagnoses that people may have gotten from a doctor that it's actually related to sleep apnea, but they never put the two together?
Sure. I'd say the two biggest organs that are affected are the heart and the brain.
Okay.
So a lot of heart conditions, including hypertension. Hypertension's a very common one. When we have sleep apnea, our body is constantly going into a fight or flight mode to keep our airway open, and that can lead to some residual hypertension, not only during the night, but throughout the day.
Sure.
You get on blood pressure medication, which can help, which certainly helps. But if you're not getting to the reason that the blood pressure is going up in the first place, which is that you're suffocating all night, you're just going to be fighting an uphill battle.
Okay.
Atrial fibrillation, very common. I get a lot of referrals from cardiologists because of their AFib patients. They're still trying to figure out the reasons, but it puts such a strain on the heart that it can throw the heart into some different rhythms.
You guys are wearing yourself out at night when you're supposed to be resting.
Yeah.
That's why if you have any of these, you need to get with Dr. C. What else? What are some other weird things that you'd be like, that's related to sleep apnea?
Yeah. Issues with the brain.
Okay.
It's not just about being tired. When we go into REM sleep, our brain washes itself out. And during REM is when our airway closes, we just never stay in REM sleep because that's when your airway closes. So your brain never goes into REM sleep. That is when the brain cleans itself out. And if it doesn't, you're going to end up with plaques in the brain, which can lead to Alzheimer's and cognitive decline,
Sure.
Parkinson. There's a lot of correlation.
My bonus dad, we've learned tons about plaques in the brain through Parkinson's and why there's dementia related to that. And that makes so much sense because he is a gasper and a loud snorer. So I wonder if sleep apnea is not the cause of his Parkinson's, but they all make everything worse, right?
Sure, exactly.
And, 60 years of sleeping that way can add up.
Right.
Oh my gosh, that's so interesting.
Two others would be diabetes. It doesn't cause diabetes, but it can make it very difficult to maintain a healthy blood sugar level. The stress hormones that's released often in the body is cortisol during apnea, and that can really wreck our efforts to try to maintain a healthy blood sugar throughout the day and night, especially during the night.
Wow. So then could weight gain be another one?
Yes, and that's a big one. It's easy to understand. Apnea is often thought of a big guy disease, big fat guy,
Right.
and it's not. It's easy though to understand how gaining weight could make sleep apnea worse. We're going to have a bigger neck, our tongue's going to get bigger, everything's just bigger, and it's going to collapse the airway. But what is lost on even the medical community is that it's the apnea that is creating the weight gain or contributing to the weight gain.
Wow.
A moment ago, I said our body uses two stress hormones, adrenaline and cortisol. And that cortisol, again, just like with diabetes, it wrecks our efforts to try to maintain a healthy weight. It just tells our body to store everything as fat, and it raises our blood sugar, and during the night it's a very bad thing to have as far as maintaining a healthy weight.
So this is not just about that loud sound coming out of you or your partner while sleeping. These are incredible things that I would have never thought were related to sleep apnea or getting worse because of sleep apnea. That's huge.
One other one, and I actually had a patient in just a couple days ago who had gout. And I told him, I said, I can't guarantee that this is going to get better, but there's a big correlation with gout. And then one of the biggest reasons, and people are so surprised when I ask them if they have gastric reflux at night. A lot of people don't, but the people that do, their eyes get huge. They're like, how'd you know that? I'm like, well, because you have sleep apnea. And so there's a very high correlation with gastric reflux and suffocating in the night.
Whoa.
And that can get better almost overnight, literally overnight.
So if you are dealing with horrible heartburn and gastric reflux, sleep apnea and dental devices could help with that almost immediately. Yep. That's huge. I would have never put that together, would you? If you have any comments or questions, put them in our comments right here. Dr. C and his team will make sure that they can get back and answer. But the best thing to do is sleepbettersarasota.com. Give them a call and get started. Thank you for coming in today.
Thank you for having me.